Good afternoon again. Today is August 2nd, 2024, our Bariatric Friday session with Dr. Isaias Irgau. Dr. Irgau, again, studio is making a difference, so our conversations are a little bit more dynamic because we can see each other here. So how are you doing?
I am doing great, Kemal. It's a wonderful setting.
Thank you. So we are going to discuss what to expect after bariatric surgery, and we are going to try to kind of elaborate things that's going to happen in different parts. One thing that we know, and that I keep repeating, and you have been saying the same thing for a long time. What is happening with bariatric surgery, right? How long that process is getting someone, right? Like today, we have one patient from the case conference. Everything is completed, 12 points, 12 checkpoints. Cardiology clears, echo, EGD, psych, nutrition sessions, 3 of them. Everything is done. The last thing is the surgical clearance. And we cannot get hold of the patient.
Oh, no.
So always goes back to the same issue. Like this is a big undertaking. Many people don't understand what the impact is, how complicated this procedure is, or if it is even complicated as we do this in an outpatient setting and discharge our patients after the operation 6 to 8 hours average. Many people don't really understand, just like many people don't know a lot of things, but they still have an opinion and they still make decisions. So our goal is to provide that missing link for them. And if we can kind of start overall, what are the things that's going to change for us so that our expectations can be set correctly?
Absolutely, absolutely. So bariatric surgery has a major impact on many aspects of the life of the person. Let's get the obvious out, right? Weight loss. Weight loss will happen, and it's going to be fairly rapid, particularly at the beginning. In the first few weeks, and sometimes in the first few months, the weight loss could be as much as 1 to 2 to 3 pounds a day, right? So rapid weight loss is very, very common. Now, that doesn't last a long time. This is really at the beginning. After that initial spurt of rapid weight loss, there will be a slowdown, and very often we call that a plateau, where patients now suddenly, from going to see the scale changing every day, they might see it changing every week, sometimes every 2 weeks, sometimes a little bit longer. But that's very, very normal. So rapid weight loss at the very beginning, particularly in the first few weeks, and then slowdown of the weight loss is what will happen, right? Now, that weight loss will continue, obviously, for as much as 1.5 years after the surgery. And if people have not completed their weight loss or have not gotten really to the lowest point that they desire to go, they can continue to do things to make sure that the weight loss continues. But from our point of view, probably the most important thing in the long term is going to be maintenance of that weight loss, right? So that's why it's very important to implement changes in lifestyle early on, so that once those changes are in place, by really making them happen over and over in time, people actually build a habit. And habits are wonderful for human beings because those are the things that make us repeat the same things over and over again. So good habits early on so that there is going to be long-term maintenance of that.
So changing these habits takes time, and then also it requires a strong mental health. I'm going to say, I'm using for myself. Yeah. You have to clear myself. I'm going to give you one example last week. So I didn't tell you this one yet, but I was kind of proud of myself when, like I don't have these, I mentioned last week, like any calorie bombs, like latte and other things. I used to have it every day. And in the last 3-4 weeks, it was kind of like, well, on the weekend. So from my house, I can walk to Starbucks. So then it's 1.2 miles, and then coming back another 1.2. And then if I take a little detour, I can hit easily 3 miles on that walk. Most of my steps would be done. But then in between, we will pick up those poisons. And I look at it, I'm about to order it. It's 400 calories. And then I'm like, I'm a little bit hungry too. And it's Sunday. I walked, I feel good. And one pastry, like little snack, 250 pounds. And 650 pounds, 650 calories, I'm sorry, 650 calories in total. And I'm about to order it. And it's also like almost $10 total. So money was not an issue. So we could overcome that. But I'm like, I worked so hard this week with the robot lunches, and a lot of nights were salad, not like with those again rich dressings, is the olive oil and vinegar and lemon juice. So I said, you know what? I am not gonna do this. So I turned around,
Good for you.
put the order in, but it was like I was just like I'm not saying this honestly, like not saying this to be funny necessarily, but just like I have to argue with myself.
Argue with yourself. That's actually a good way
This
to
side
put
is
it.
saying
Yeah.
that, hey, go ahead and do it. Like you did it really good. You did
Yeah.
really good this week.
Yeah.
And then this side's going like, hey, you are putting all this work into this, and you are ruining it.
Yeah.
It's something that's not even important.
Yeah.
It's not a meal. It's nothing. So I'm still gonna have a meal if I do that. So I turned. You know what? I felt so good. I'm like, I need to say, I need to tell this story in the Bariatric Friday. But it's like I can imagine someone with morbid obesity. How many times do they have to make those decisions throughout the day, throughout the week? And for me or for you, it's like I guess that one time in that one of those weekend days. But for these individuals, they have to go through this every day, every 2 hours, every 3 hours. They have to make that right decision. So, and changing that habit doesn't going to happen quickly. So I think we definitely pick up those habits early.
Absolutely, absolutely. The good news, however, is that the surgery actually impacts greatly that sense of hunger, that sense of wanting to eat in a good way, meaning that people are actually much, much better at controlling those urges once they have surgery. And one of the reasons is because, particularly with some of the surgeries like the gastric sleeve and the gastric bypass, there is actually an influence in the way our digestive tract communicates with the brain to curtail this urge to eat, to have hunger, to wanting more, essentially, so that people have a much better control of the surgery. So before the surgery, the struggles are obviously much, much higher, but after the surgery, they have this too. But regardless, as you correctly said, unless we put our mind into this, it is very easy to slip into bad habits, and habits are what they are, essentially. They can become entrenched, and then it's very difficult to get out of them. On the other hand, if they are good habits, we like that entrenchment of the good habits because they will sustain us in the long term.
Exactly.
So the other change, obviously, just getting into it with your example as well, is diet, right? So there are some very important changes earlier on after the surgery in terms of the types of food that the person is allowed to eat or not allowed to eat, right? So the first 2 weeks right after surgery, they're going to be on a liquid diet. Liquid meaning anything that they can only drink. They cannot have any type of food. And this is very important. This is valid for the gastric sleeve. It's valid for the gastric bypass. It's valid for revision surgery. And what it means essentially is that for those 2 weeks, they will have to protect their healing stomach, healing digestive tract, with just doing liquids, right? And the good news is, again, because of the surgery, they will not be hungry. So they will not be struggling really to want foods at that time. And actually, the vast majority of patients tolerate this very well. In fact, if anything, our struggle is to really to push them to get enough liquids in that stage, particularly because dehydration could be a problem, right? So the first 2 weeks, just liquids. After the first 2 weeks, they will progress to a diet that we call pureed diet. Pureed diet they will have for another 2 weeks, which will be a month, after surgery. The definition of pureed diet is foods that don't require chewing, right? So anything that they have to eat will have to be either mashed very, very finely, blenderized, pureed, right? So anything that they would not give to a child, to an infant with no teeth, they can have. So I tell my patients, pretend as if you have no teeth. And if you look at something and it requires chewing for it to be eaten, then you cannot have it. On the other hand, if you change its constitution so that it can be eaten without having to chew it, then they can have it. So they will be able to expand their options of what to eat after the first 2 weeks, but they are still limited unto what they can have. And I do want to stop on this point a little bit, Kemal, and explain why this is important. It is important because if people were not restricted to this type of foods, if they were to go out and try to eat a hamburger, pizza, or steak after surgery, they could really cause a lot of damage to make themselves really very, very sick. In fact, the wounds on their stomach or their intestine may be disrupted, and that can lead to very serious complications. So it's very important for people to adhere to that. After the first month, they will be introduced to chewable food, and that will expand even more their options. But again, it's very important for people to understand that their sense of smell, their sense of taste, their ability to eat a lot at once is very, very different now after the surgery. So certain foods that they may have liked before, they may not care for right now, or other things that they didn't like before, they may be okay right now. So what I tell people is that when they introduce the chewable food phase, before they make a meal out of something they haven't had since surgery, they probably should just try a little piece and then wait maybe 5-10 minutes to see how it settles down. If it's good, then they can have it. If not, they move to something different. So there is this transition in terms of the type of food they will be having after the surgery.
So now all these changes that they are going through, one thing that, again, I'm trying to pick up certain things that you say, the hunger won't be there as it was before because the part that makes us hungry on the stomach is gone.
Yes.
So they are not going to have the same challenge that they were having before to make those decisions.
Yeah, absolutely.
So, but I think what I see as an advantage to pick up these habits and have that discipline early on. So when you are able to make those decisions with the pressure of hunger on one side, as soon as you go through the surgery, you have the discipline, and now the hunger is gone, so you don't have to deal and fight with your own, and then things are going to be much easier. So, and then because you have to follow certain restrictions, it's the discipline. It all comes down to the discipline. That's just, our body is not a dumpster. So we are not going to just, pick everything and then just throw everything in our body. It's not going to happen. So because of that, we need to kind of change those things. You can't just wait, oh, I'm going to have the surgery and that day I'm going to change everything. That's not going to work. So,
absolutely.
Absolutely. I share, my own diet regime time to time, and I did again last week. When I'm going through this robot, I'm still doing 17 hours. 17 hours. Intermittent fasting Monday through Friday. Now, and honestly, is the best policy. So, like today, I'm similar to last week, so I'm probably reaching to the hour 20. I'll probably have a gyro. So, donor. So, but here's the funny thing. Last week, because I did the same thing after 20 hours. So, and I ate the dinner, and I was under the impression that I was going to have dinner. Like I was going to eat none. So, didn't eat anything. So I had fruit and other stuff, but did not feel like I was, because I think it says, hey, this is way more than what I need. Yeah. And I didn't have to go through more food. And honestly, I don't have to do a lot of things when I don't have to prep food and clean up the dishes and all the other stuff. So
no, it advantages of intermittent fasting, right?
Right. Yeah. I mean, this is life is simpler if you put the energy and your focus on, oh, I'm gonna get so much satisfaction from this food. You are rules. I mean, your life and your diet is rules because there isn't anything that's going to give you that satisfaction. It's just the mind game that your brain is perhaps playing. So that's why you have to kind of learn some of these and adapt them.
Absolutely. So just to reiterate the issue about the changes in terms of how hungry people are and what makes them satisfied, that is really dramatic in the way it happens right after surgery, particularly. So people will be really very comfortable not having food for a while and just being satisfied with a small amount, essentially, right? But obviously, after a while, the excitement of the surgery goes away, and then they go back to a routine, and it's very easy to slide into bad habits again, right? Even over what the surgery has done. So that's why it is so key, really, to focus on utilizing the first few months after surgery to really implement good habits that are going to carry them through for the long term. Because again, what we want with bariatric surgery is an improvement in health that is not only for the short term, but it is for the long term. And for the long term, the surgery itself, without involvement of or implementation of good habits, cannot happen, which takes us to the other chain. And the other chain that we want them to implement is exercise, right? Activity. Now, early after surgery, we want people to actually be moving, right? In their past, certainly when I was about to embark on medical school, which is many, many decades ago, and you probably were a kid or even not born at that time.
I was born, probably.
So in those days, actually, people used to come to hospital, have a procedure, and be in bed for the longest period of time, right? So in other words, once you have surgery, you acquire this role of the sick person, and the bed becomes your refuge, right? And we do not want that mentality. That mentality is not only bad for recovery, but it is dangerous because it can bring about complications like blood clots. So our motto really is for people to move early and move as much as they can after surgery. In fact, as you may have seen in our surgery center, within a couple of hours after surgery, you see the nurses taking the patients around to move around, right? Because movement is critically important. And we want people to continue to do that. Now, yes, they will go to bed to sleep. Yes, they will go and lie down on their sofa when they are tired. That is okay. But their default position when they are awake has to be walking. And walking is really the foundation of exercise. So when people ask me, when can I start exercising? My answer is immediately, right? Because walking is exercising. Now, there are going to be some restrictions for some types of physical activity. For instance, weightlifting is limited to about 15 to 20 pounds for the first 4 weeks. Similarly, because the surgery occurs on the abdominal wall, we ask people not to engage in exercises that require the core abdominal muscles, again, for about 4 weeks. But for other types of exercise, obviously, starting from walking, they can start doing elliptical, stationary bike, treadmill, and even rapid walking as much as they feel comfortable, essentially. They will find that earlier on after surgery, they may get tired very quickly. In fact, they may find because their expectation for the surgery is for them to be really feeling not so good for so many days. Once they get up and walk and recover so quickly, their mind actually may recover a lot faster than their body. Right. So they may want to do it, of course, and that's a good attitude, but they will find that they can get tired very easily. And that's also the same reason why we ask people to take at least 2 weeks off from work to recover after the surgery. Patients ask me that, can I work from home? And very often that may be possible within days after surgery, but again, they shouldn't expect to spend 8 to 12 hours a day. Even if it's from home, it's still taking their attention away from their own care when they're working. So I ask people really to try to take a couple of weeks off to the surgery for their recovery.
When you were talking about the exercise and the mobility and why we have to move, and we try and make connection with how we do certain things, and then if these are can we expect these from others? So I give you the intermittent fasting, the raw hard on top of it, right? And clear from desserts, any type of ice cream, this or that, you know. So what I see on top of those two, I still have to put 9 to 10,000 steps. So, and then as you know, I'm listening to you as part of this show. We are doing this together, but also I'm also learning, and also I'm making some clicks. I'm like, hey, this is what we have to kind of emphasize. So it's not simple. I mean, just me doing low carb or me doing just intermittent fasting by itself without putting effort on the fitness is not gonna help.
Absolutely.
And once again, these things, you know, I'm not saying this as a medical doctor. You are the medical doctor in this relationship. So I'm saying this from the just like from the regular person standpoint. Once you build those habits and repeat them certain frequency, your body is already asking you to do them. Like it said, hey, let's go, let's do this, let's do that. Like just an example to that, like last night, you know, I had a long day. I was able to walk a little bit in the movie, like trying to in this new office, kind of even just walking the office is giving us some extra steps, and then I walk around the block. It gets me 4,000, 4,500 steps, but then it's 10 p.m. and I'm like, hey, and I have a puppy, of course, but he's not a puppy at all. So, hey, we have to move. We just went out and like 35 minutes or so, it was hot, but it didn't bother us because we are doing it on a regular basis.
Yeah.
But maybe a year ago, it would be a problem. So when you build those habits, I think things are going to happen. So as much as we want people to expect everything with this, you know, magic with the surgery, the things are only going to happen if right things are in place. So one other thing that I want to kind of focus on is, like you mentioned a little bit on the potential complications, long-term and short-term. How often do we encounter those problems first, and what are the common ones that we have?
So actually, this is a very important topic for our purposes here, because obviously we're talking to people on how their recovery will go, but also at the same time, we want to educate them about really being perceptive to signals of potential complications. As you mentioned, complications, especially major complications after bariatric surgery, have really become very, very rare in our program. Really, things like infections due to leaks, blood clots, and bleeding are extremely rare, but they're not zero, right? One of the reasons they are low is because we focus on prevention, and we've done really, really well in keeping those complications in the low side in terms of their frequency. But there is another side to prevention, and that is if a complication is arising, the earlier you can get to it, the better it is in terms of managing it or decreasing the consequences of that complication, right? So the really serious complication like leaks from the suture of the stomach, you know, the wound on the stomach, blood clots, or other infections, these things can happen, and body will tell the person that they're happening with signals, with symptoms, right? So anytime we tell patients, particularly early within the first 4 to 6 weeks, 8 weeks after surgery, if they are feeling that they're having severe pain, that they're having nausea, vomiting, fever, generally not feeling well, we want to hear about that. My general advice to patients is that they should feel better every day that passes, in that there should be progress in their recovery. So today should be better than yesterday. Tomorrow should be better than today, and so forth. If they find themselves going backwards in this process, for instance, if they feel that that day is actually worse than the previous day, you know, something is not right. they should have a low threshold to call us and let us know, right? So complications are very rare, but it's important that patients are educated about really times in which they have to alert us if they don't feel right, particularly in the first few weeks after the surgery.
Most of the short-term complications, they happen in the first 1 or 2 hours of the procedure.
So there are complications like bleeding, for instance. If they can happen, serious internal bleeding usually happens within the first few hours after surgery. That's why we keep our patients for at least 6 to 8 hours in our center, right? But other complications, like for instance, infections due to leaks from the stomach or blood clots, those can happen within the first few weeks, at any time, certainly earlier, more frequently, but even late, 4 to 6 weeks after surgery, they can happen. And if patients are not feeling right, they are having too much pain, if they have nausea, vomiting, I don't feel well type of thing, it is important for them to alert us, because the earlier we can get to them to help them, the better rescue plans we will have to get them out of those complications.
We have those appointments right after surgery, post-op appointments within the first 10 days and the first month. And then after that, it goes on a regular basis. So you should be able to check.
Absolutely. And we are available.
My speak was like, I mean, I run the surgery center. So every time there's a complication, I get a phone call 24/7. We don't have.
No, we've done very well.
I mean, we may have 1 or 2 in the last 7 years.
Yeah.
But these are, yes, of course, we have to let people know what the risks are, but how often it happens. I mean, someone getting hurt on 95 is higher than probably having complications from bariatric surgery. That's
Certainly, we can compare bariatric surgery to other surgeries. We have data to show us that. So we know, for instance, that the safety of something like a gastric sleeve or sleeve gastrectomy is comparable to gallbladder surgery or appendix surgery or hysterectomy, which are extremely commonly done procedures. So yes, complications can happen, but the frequency of those complications is extremely low. And then obviously, whenever we look at potential complications to any medical intervention, the most useful way to look at it is to look at the risks of not doing surgery versus the risks of the surgery, essentially. And our patients are really dying under the weight of very, very high body mass index with potential issues like diabetes.
It's almost like the opportunity cost.
Absolutely. So that is why we say, look, this treatment really has potentially these complications, but without the treatment, actually the risks of serious diseases, the risks of dying early are this much, and that's why we recommend the treatment. But as you correctly said, serious complications are very, very rare, but it's important for patients to know that number is not 0. So if they do feel any type of worsening of symptoms, we want to know about that early on.
So we also want to discuss the emotional and psychological changes. And I want to actually add one thing to the earlier example of this patient who stops the process at the level, the last point with the surgical clearance. This is from this morning, so it's kind of, it's fresh in my head. So what we try to do is understand the process, understand the individual, understand what they may be going through. What that means is that not every patient is going to be the same, but for our patients who dealt with morbid obesity for years and years and years, the psychological issues may be at a different level.
Yes.
So I'm talking about like the depression, anxiety, those types of things. Now, the medicine is extremely complicated science, so that none of the disease is by itself. So this patient A1C was almost 10. So we were able to control that, but my first reaction to the team was, hey, just take it easy on the patient, because look, their A1C just recently reduced. And what we know about patients with uncontrolled diabetes is depression.
Yeah.
So, and that patient may process things differently, right? So already dealing with morbid obesity with 52 BMI for 20 years, that build up enough. On top of that, there's the uncontrolled diabetes. And now patients have this irrational decision last minute. Hey, we understand. Sure. That's going to happen. Yeah. But that's part of the process. And we also have a good understanding of what our patient needs. But this emotional and psychological changes doesn't stop after the surgery. So there's still things involved, if you can elaborate.
Absolutely. I mean, that's actually a very important backdrop, to the whole issue. As you correctly say, struggling with obesity over many years does have an impact on the person's mental health. And to that, you add the perception of society that has this stigmatization of obesity, and that really adds to the complexity of the mental health issues that can arise, right? Now, that is rapidly changing after surgery. And a person who's used to seeing themselves in the mirror in a certain way, or they're used to seeing themselves on pictures and photographs in a certain way, that physical picture is changing, right? Well, the mind may not have had time to adjust to that. And that can raise really a lot of anxieties and concerns that may require ongoing counseling. That's why it's very important for our patients to see a counselor before the surgery, but we do encourage them to continue seeing one also afterwards, particularly if the struggles continue. But it's not just about how they see themselves and how they struggle, with their innermost, but also how they may be relating with others, particularly close loved ones, maybe the fact that they were heavy had established a certain level of relationship, right? Where the obesity was just part of that relationship, right? And when that changes, the relationship may be changing. We hope for the better, but sometimes it could change for the worse, right? Maybe that sense that person is now liberating themselves from obesity could create some insecurity among their loved ones, right? And that could be a source of conflict. So it is very important, for instance, to involve their loved ones in the process earlier on and make sure that they are on board to support them. That support is critically important. But that just shows you how complex the whole issue is. And you're absolutely right. From an emotional point of view, from a social relationship point of view, there could be challenges afterwards that many people may not be prepared for. But again, this is not a road that they will be traveling by themselves. We are there to support them. We are there to provide them with resources that could help them with this as well.
The reason I'm smiling is our audience would probably, if they've been watching, they know that we are close friends. So I just realized that if I don't remember the topic and I stay focused, we can talk 24/7 on this. So, and I'm like, hey, we are reaching to the 40 minutes time. So the reason I want to kind of wrap this up, and then I have this idea. I don't know if you're going to like this, but let's see. So before I forget, today is my dad's birthday. So and then I know he's watching, but he doesn't understand English. So but still, you're gonna
happy birthday, Mr. Erkan Senior. Happy birthday.
Mehmet Bey, doğum gününüz kutlu olsun. Now, we want the longevity of what are the real main elements of after post surgery in terms of expectation. So think as like Roger Federer or when he was playing Tom Brady, Kobe, all these top athletes. When they are better, they don't actually loosen up their discipline, right? So, like Djokovic, I'm not a big fan of him, but he's almost 40. He's getting to almost 40, and he's practicing just like if he was 60. So he won the most number of titles and still doing what he was doing when he was 16. So because the thing that we are trying to do is we need to follow certain guidelines. So from our program. So the things that I want our patients to remember is your follow-up appointments. Please, please, please come to your follow-up appointments. I know most people, they do make their 10-day post-op, but when it comes to month, 3 months, 6, and then every year see us once a year, they don't give themselves that. During that, they fail. So let's not do that. To take advantage of our nutrition program, our dietitians, there are 5 of them right now, they're available. They can help. They do help. Our bariatrician, Dr. Singh, is available, but also your primary care is available. So don't get comfortable. Oh, hey, I'm losing so much. The reason I do this professional athlete. So they get so comfortable, so they stop practicing. That doesn't happen. They work even more. They practice even more. So, and then make good decisions to make sure they also like the monitoring, like fitness and the diet journey. It helps me a lot, and I know it will help those because we also don't realize how much we eat. Please just write down what you're eating. If you don't want to use any applications, fine, just write it down on the paper. Which is not going to be that it's going to be easy once you actually start doing it. So stay in touch and make sure that your success after surgery, because this is the most powerful vehicle for morbid obesity. So in order for this tool to be the best, most efficient, is requiring certain modifications. We expect and we guide our patients, and hopefully they can do that.
Absolutely.
So, Dr. Thank you for joining us in person. So this is a lot more fun.
It is.
So we'll be back next week with another topic. Thank you so much for joining us.
Bye-bye.